Welcome to Undercomplicating Stuff, where we, two psychologists and coaches with over 40 years of combined experience, share our insights to undercomplicate important topics. A friendly reminder that this video is meant for conversational and entertainment purposes only. Please see the information section below this video for additional resources. Dr. Gedeon, do an introduction.
Thank you, Julie. I'm Stacey Gedeon. I'm a health psychologist and the founder of a healthcare consulting and professional coaching business. And how about you, Dr. Radico?
I'm a psychologist, a coach, author, and a speaker. Our question today is a great one. It is, what qualities should you look for in a therapist? Where would you start us off at?
Yeah, I love this question. How do you know you have one that's a good fit, one that is having expertise in the area that you're needing help with? And there's so many things we want to look at. And an initial step might be asking a friend or a loved one or your EAP, if that's an option at your work, for a referral from people that you know and trust and finding out if they would be perhaps a good fit for you. A lot of therapists will offer a complimentary consultation, and you can get a sense of whether you might match up well with what you're needing and so many other things. What comes to your mind for things to look out for?
I think about it as warm leads and that you trust the people in your life to give you recommendations for people who are going to be helpful. Yeah, looking at your employee assistance program, like your EAP, your insurance, there are websites like psychologytoday.com, therapyden.com. I think that my brain then goes to what are the things that you want to look for in a therapist when you're like
Hmm.
doing that intro call, as you talk about, that goodness of fit. And you want to have a sense of their professionalism, their credentials, that they're qualified around helping you with the issues that you're bringing. So I know like Stacey, you and I are very much in the weeds with this of like we know that there are tons and tons of different evidence-based therapies that are out there. Some focus on helping people with trauma, some focus on helping people with sleep, some focus on helping people with social anxiety. And so people can be qualified in all of those areas, like qualified to treat people, that they may present with any of those issues, or they might specialize in an area. So for example, I don't specialize working with people with eating disorders. There are amazing therapists who do work with people with eating disorders. I just don't have that expertise. I might be able to help somebody recognize that that is going on for them and that that might be an issue like that's diagnosable. But in that first meeting, if a person is coming to me and saying, "Yeah, I want to do therapy with you because I have what I think is an eating disorder," I need to be really transparent about the scope of my practice, my credentials, and the ways that I could support them, and the ways that I could support them maybe better by helping them find somebody who does specialize in that area.
And that leads me to think about ethics.
Mm.
We are beholden to an ethical standard both when we're coaches and when we're psychologists. And knowing what you can do and what you can't do and what you're trained to do is critical. And it's okay to ask someone, what's your experience? We'll take the eating disorders example. That's a really common one. What is your experience in treating people with eating disorders?
Mm.
And knowing when to refer out is just so critical. I'm also thinking about in that first meeting, whether it's a consultation or in therapy session, even small things say a lot. Is your therapist on time? If something came up and they're running late, did they notify you or do they acknowledge, but I'm sorry I'm late, that I had trouble with the internet connection or something else? So are you feeling like your time is being respected? Is
Mm.
another small thing to look for in terms of deciding if this therapist is a good fit for you.
Mm,
And certainly then if you get past that and you think, okay, yes, this person seems to have the things that I am needing in the area that I need, and you start meeting with them, one thing that's really important is to feel comfortable expressing your thoughts and feelings
mm,
and not feel that you're being judged.
ugh,
Having the safety to be yourself, and it takes time to feel comfortable. That's totally understandable and is part of the therapeutic process. But being comfortable in being yourself is really necessary for therapy to progress.
yeah, I think you are pulling out one of the biggest, most important aspects, that authenticity.
Mm,
That you want to trust that your therapist is showing up in a professional way, but also in a congruent way. And I'm mindful that that's jargon, but like that if we're working together and I'm your therapist, you'd want to be sure that I'm showing up in a way that, like, yeah, I think Julie truly believes what she's saying.
mhm,
I think she is sharing with me what she thinks is actually going to help me. I think she does care about me when she, makes an empathetic statement. I don't think she's just saying it because that's what I want to hear. I think she asked me questions with good intent, with like wanting me to understand more about myself. If you are working with somebody and you feel like any of those things that I just talked about aren't there, it's probably a sign to check in with your therapist, because maybe there's a type of treatment you're doing. There's something going on where you're getting somewhere that the therapist has a good, clear reason. There's like evidence behind what they're doing, and it just feels off. Like it's hard. Therapy's hard work, and it's just you're not getting it just yet, but maybe you're right there to get it. Like make space that that could be the case. However, if you show up and you're like, I don't even think Julie gives a crap about what I'm saying. Like she's looked at her phone, she's, like filing her nails, she's, needed to step away 5 times to deal with something. Like there's lots of things we can forgive and be kind about. But if you're like, this is not a one-off, this is a pattern, this is me feeling like I don't even understand what we're doing here, like this isn't helping, those are red flags. That the therapist is somebody you should show up for and with, and they're showing up in a way that you're like, yeah, I get who Julie is. That therapist should never say or cross boundaries that make you feel unsafe. Like thinking about red flags, yeah, you want that person to really like get the sense that they care about you. You also never should be in a situation where you are feeling unsafe with that person and that they are making any sort of statement or advance that makes you feel like physically, emotionally, like you're just like, what are we talking about? Like this feels dangerous and unsafe. Like, and I purposely, we can give examples, but like, I want to say it in a way that people understand that like that's your judgment.
mhm,
Like there are some clear like flags of like somebody should never be like, oh, here's a inappropriate sexual statement.
mhm,
Nope. But also if you're feeling uncomfortable, if you're like, I feel unsafe with this person because of X, trust yourself. And like that is a big red flag of we need to maybe not work together, or I need to report you to your licensing board because I am worried about how you might be treating other people as well.
less less scary things than feeling unsafe might be if you find that your therapist spends most of the time talking about themselves. That's a sign that perhaps you need to have a discussion if you're comfortable pointing that out. The other thing is you can not be friends with your therapist. And
Mm,
so if there's an indication that the therapist suggests you meet for coffee, and it can be tricky I'm in a rural setting and there are so many multiple relationships, and
mm,
those in and of themselves aren't unethical. But there's a line that if it's crossed is really a sign of a boundary crossing
mm,
and shouldn't be taking place with your therapist. You don't want to know a lot about them, and that's why we're trained as therapists to not share a whole lot unless it's in service of something that we're doing with you or that we're talking about. So when used appropriately, self-disclosure is therapeutic, beneficial, and something that can really move therapy along, as long as it doesn't turn into it feels like a friendship or it feels like you're doing more support of them than they are of you.
Agreed. I imagine as you're saying that, people are probably like, "Oh yeah, I have a friend or a family member that whenever I share a story, they're like, "Oh yeah, that happened to me." Your therapist is not one of should not be one of those people. Like, the therapist should not be the, "Oh yeah, that happened to me." That's not what therapy's about. The therapy should focus on you. And yes, I mean, you're allowed to make space for, in therapy that you want to know who your therapist is in a sense. You want to learn a little bit about them, right? You want to know they have credentials. You want to know that they have experience, that their scope of practice. Like if you're working with somebody for eating disorders, they know what they're talking about. You also might or be interested in like, oh, where are you in the world? Who are you a little bit? Like, did you have experience working? So I worked in medicine for 10 years, and I now work with a lot of women who work in medicine. I think they like to know that I understand the jargon. They don't have to explain to me what, the ICD is and what the codes are and what not that I'm pretending I know all the medical stuff, right? I'm staying in my scope. But if they're saying, oh yeah, here's some jargony type of thing, it's like, oh, I recognize that. Like I understand. What we're saying here is if there's a self-disclosure, if you're learning about the therapist in any type of way, it's all in service of you as the client, that it means something. The therapist has thought really, like maybe quickly, but thoughtfully about, if I share this, how is that going to impact the relationship? Is that going to impact the relationship in a positive or helpful, constructive way? And how is that going to serve the client right now? If
Mhm.
that's going to help them feel less alone and still keep a good, healthy boundary that they're not worried about me, because that is key here, then okay, maybe. But if it's going to lead to, oh, now they're worried about me as the therapist, no, that's a pink flag leading toward a red flag of if you're showing up to therapy and you spend a lot of time focusing on the therapist or you're worried about the therapist, that's not conducive to good therapy. You're as the client, this is your space to come as you are, to feel accepted, to be in a safe space to share your honest thoughts in a confidential, private container that's not getting shared outside anywhere. And knowing that that therapist is not somebody you then have to go worry about in any of the ways that we've highlighted.
Right, that is so critical. And you mentioned the therapeutic container, which again can sound a little jargony, but basically, you want the therapeutic relationship to feel comfortable in a space where you can feel the feelings, have the thoughts, and the person doesn't rush to make you feel better or fix you or get rid of the tears. You know you're with a good therapist when they can sit with you in
Mm,
that. And it may be uncomfortable for you to be that open and that vulnerable. A good therapist will also help you feel safe in doing that. There's no judgment, there's no criticism. And that's another sign that you're with someone who does good work and is able to manage the difficulties and the challenges that come up with emotions in therapy. And you again don't have to protect them or shield them from what you're experiencing, or even thinking about past traumatic experiences.
mm,
A lot of clients will struggle with it's difficult to bring up anyway, but they may not want to burden their therapist. And it's
mm.
our role to explain how that will not be an issue because of the way that we're trained. And I think that's another important thing to keep in mind.
Yeah, yeah. I've worked with some really kind, thoughtful people, and after they've said, here's this terrible thing that happened at work, and they're like, sorry to lay that all on you. And I'm like, that's the name of the game. Like that is what we're doing here. You don't have to worry about me. And so it's a kindness. And if you say that to your therapist, they're gonna be like, I appreciate it. That's not your job.
I
Like, your job is to show up and share and process and know that you're going to be held in a safe way as you do that. So my takeaway for this topic is you want to find a therapist. You want to look for the qualities of somebody who's genuinely interested in you, that they're curious, that when they ask questions, it's not, they're not curious in like a gossipy kind of way, like, oh, what happened next? They might be because if you build up a rapport that way, okay, but it's to serve a purpose. They're curious about who you are and your goals for the time that you are spending together and how to help you reach those goals in a way that you feel supported and accepted. And they honor the fact that you know yourself better than anybody else. So your therapist is going to meet you where you're at. They're going to come with tools to help support you, but they're not going to tell you that you're wrong or tell you how best to like fix you. They're going to walk with you on a journey of, hey, I'm here to support you. I'm here to accept and listen, but you gotta like work alongside them. And if somebody is coming to tell you like this is what you have to do and you're wrong if you don't do it, or they're just like, ah, whatever, do whatever you want. Like there are two ends of the spectrum that are not helpful. So your therapist is going to meet you where you're at and try to support you in good evidence-based ways for what feels most helpful to you at any given time.
Before the takeaway, just to add on to what you just said, an analogy I use with people is you're the bus driver, I'm the navigator, or maybe you're the
Mm,
captain of the ship and I'm your compass. And my role is to help guide and maybe point things out and give you tools, but you
mhm,
ultimately make the decision. So I love that you brought that up. My takeaway, and it's something that we say a lot in our videos, is trust your gut. If it doesn't feel right, if it's feels icky, even if someone that you know and trust says this is the best therapist ever, but you're not feeling that connection,
mm.
move on.
It is okay to break up with your therapist, and we will talk about that in another upcoming video. Again, going into the idea of you don't have to worry about your therapist, break up with them if that's what feels healthiest to you. That is something that they have experienced. Every therapist has a client that's like, "Hey, we're not the right fit." That's okay. I love that as a takeaway. If this topic resonated with you, please share it with somebody that you care about. Also, please comment, like, and subscribe. You can message us on YouTube or LinkedIn with questions that you'd like us to discuss in future episodes.